This is LiveWell Talk on the new Clinician Spotlight. I'm Dr. Dustin Arnold, Chief Medical Officer at UnityPoint Health, St. Luke's Hospital. Today's episode is another installment of a series of podcasts where we sit down with new clinicians at UnityPoint Health, Cedar Rapids, and get to know them as a clinician and as a person. Our guest today is Alyssa Grissom, Genetics Advanced Practice Nurse with Genetics and Cancer Risk Assessment Clinic at Nassif Community Cancer Center. Alyssa, welcome to the podcast.
Thanks for having me.
Welcome to the community.
Thank you.
Well, to start off, tell us a little bit about yourself. Where are you from?
I'm from Dayton, Ohio.
Dayton, Ohio?
Dayton, Ohio. Born and raised there. I lived in Chicago for about 9 years, San Diego for about 1, and then I'm just moved to Iowa from Vietnam. So I spent 3.5 years in Vietnam.
What'd you do in Vietnam?
I was doing working, and University of Pennsylvania has a global health program. So
wow.
I was sent over there as like a collaboration between UPenn and Vietnam. So I worked in the oncology department and basically worked on like the training of the nursing staff there and cancer care.
How was that?
It was an amazing experience.
I bet.
It's definitely, there's things that you miss about the U.S. when you live overseas,
right.
But also it's nice to see a different aspect to how healthcare is and just how people live their day-to-day lives.
What do you think the biggest difference between healthcare between the United States and, in this case, Vietnam was?
I think, we more resources, just solely as, we're English speaking and a lot of things are published from the United States are published in English in general.
Right.
That there is a barrier for practitioners there to keep on new evidence-based guidelines, new practices if they don't, English is not their first language.
Right.
So you just see gaps and not only just because of the resources that are available, the cost, the affordability of care, but just so simply that if English is not spoken by the practice team, you're going off of whatever has been kind of done in that country for many, many years.
Like Latin, maybe a little Spanish I can read. Mm-hmm. And I can get the context of the paragraph,
right.
but it's not like I'm reading it, like a new medication that I'm going to use that information on another human being. You know what I mean?
Right.
So, yeah, I can imagine that would be difficult. Now, do they have socialized healthcare or single-payer system? I mean,
it's like a pay-for-service, so basically you just see a difference in the type of care that people can get, right? So obviously the more money you have,
right. Maybe
the better quality, nicer facility, more access to different medications, whereas if you don't have enough money, the treatment is tailored really, based on what you can afford. So it's not kind of standardized as much as like in the US and Western countries where we see a lot more standardization of practices.
Yeah.
It's a lot more tailored to what the individual can even afford.
Yeah, I mean, you can say that we have universal health care in the standpoint that every single person is entitled to be seen in an emergency room and cared for, right? Might bankrupt them, but that's course. Right. Well, do you have a family? Right.
I have a dog.
You have a dog?
I have a dog.
Well, this is a dog-friendly podcast. What's your dog?
My dog's name's Archer. He's actually in Ohio with my family, so he did not go over to Vietnam with me. They took care of him while I was overseas. So even though he's my dog, he's in Ohio right now, and I'm not sure I'll get him back.
What sort of breed is he?
What was that?
What kind of dog is he?
He's a mutt.
Just a mutt?
A mutt. Yeah. But, shelter, and my parents just love him.
Dogs are angels without wings.
Yes.
People don't deserve dogs.
Yes.
So now that we know about your kind of who you are, but tell us about your educational background.
Yeah, so I did undergrad at Wright State University in Dayton. Went to Loyola in Chicago for the Master's in Nursing program. Took a course in cancer risk assessment through City of Hope. That was back in 2020. And then I'll be hopefully going to the University of Iowa for a PhD. So that's kind of what brought me to live in Iowa.
What will that PhD be in?
So PhD in nursing, but I'm going to focus my my studies on cancer genetics.
Okay.
So it's a kind of perfect combination between what I want to study and then the job that I'm doing here.
Yeah. Does that, and how many years is that program for, like a regular PhD, like 4 years?
Yeah.
Yeah.
As fast as I can
Time will pass
get through
anyway.
it. Yeah.
What got you interested in genetics and cancer risk?
Yeah, so I've been an oncology nurse for 16 years. So I was an inpatient staff nurse, worked in outpatient infusion, giving, chemotherapy and the drugs. And then as far as advanced practice, I'm certified as a clinical nurse specialist, which is a little bit different than a nurse practitioner. Both advanced practice nurse, but the clinical nurse specialist role was more in like nursing practice, system processing, quality improvement, program development. So that exposed me to a lot of different aspects of cancer care, palliative care, chemo administration, distress screening. I mean, it just broadened my experiences. It did take me a little bit into genetics. And so I just kind of got more fascinated. It's one part of oncology care oncology care in general is growing so rapidly, but genetics is just even more so an everyday component of our practice. It's only going to get...
Yeah, it is almost overtaking traditional oncology from that standpoint.
Right. So I just kind of wanted to focus specifically just in, genetics.
Are there specific areas of genetic cancer care or screening risk that you find rewarding?
When you get to, obviously it's nice to help cancer patients make informed decisions about, their management of their current disease, but it's even more rewarding when you are screening unaffected people earlier and can catch something earlier. That's rewarding in itself because we're impacting, their overall survival and prognosis if we're able to detect them and inform them. They can make lifestyle choices. They're more informed about their body or symptoms, and they're even more proactive with their care.
Right. Well,
if they're more knowledgeable that they're at risk for something, they're going to be more informed and take.
From my area of specialty, internal medicine, I always describe genetics as it's kind of like an empty handgun. It's not necessarily dangerous by itself, but you start putting bullets in the chambers, diabetes, hypertension, sleep apnea, nicotine use. Now you have a very lethal weapon.
Right.
And so, I've kind of always used that analogy in my head when talking to patients. How did you end up here at UnityPoint Health?
So it was kind of just the perfect combination of finding the program and the mentor for the PhD that was going to allow me to do the research in genetics and a job. And so I found that perfect combination in Iowa.
Well, we're lucky.
Brought me here.
It's a service we've been fortunate to have for a while, genetics in our cancer clinic. It doesn't go unnoticed that we're pretty blessed to have this service. From other specialties. Well, we kind of learn what motivates you on a daily basis for cancer care, et cetera, to help patients, which is outstanding. But what do you do for fun?
I've been enjoying the bike paths around here.
Okay.
So I love being back on the bicycle. That's not something I could enjoy over in Vietnam. I love to travel still, obviously. You can see been to many different places, lived in many different parts of the U.S. and other countries. So I love to travel, camp, hike. So looking forward to seeing what the community has to offer.
Wow. Well, I think you'll enjoy it. We do have some nice bike trails and hiking trails. If there's one thing you'd like your patients to know about you, what's that?
I think that, the most important for me is to spend time with them to make sure that they understand, as far as, when we're talking about genetics, how this test is meaningful for them, how the test is meaningful for their family, making sure they understand, and can make an informed decision. So I think for me, I love spending the time doing the education and talking and getting to know them. So I really want to be able to impact them on that personalized
outstanding
level.
I agree with you. One of the funnest things that I do, or most rewarding, is just to spend time and explain stuff and walk out of the room going, that you made a difference, right? And that's what it's all about at the end of the day. Well, Alyssa, thank you for joining me. It was fun to get to know you and know what brought you here, and hopefully what will keep you here at UnityPoint Health, Cedar Rapids. Once again, this is Alyssa Grissom, Genetics Advanced Practice Nurse with the Genetics and Cancer Risk Assessment Clinic at Nassif Community Cancer Center. If you're interested in scheduling a genetics consultation with Alyssa, call Nassif Community Cancer Center at 319-558-4876. 319-558-4876. Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe. And if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.